Have you been diagnosed with endometriosis? Endometriosis is the diagnosis where you find endometrial type cells that are not located within the uterus. So they're found outside of the uterus. They can be on top of the uterus, they can be on the ovaries, they can be on the abdominal wall somewhere, they can be embedded inside the pelvic floor, or you can find them even on the lungs or in the brain. So this is just endometrial type tissue that's in places that it's not supposed to be. Now, we don't have a really great explanation for why endometriosis happens. So endometriosis can happen for what we think of as genetic reasons. It can happen because of environmental reasons or because of hormonal reasons. There is no real clear explanation. It is clear that it has been debunked that it is not because of retrograde menstruation, where people thought that menstrual tissue that would slough from the uterus lining every 28 days or so when you have your period, and it would go embed in other areas of the body because it wasn't sloughed in the right direction. So it went the wrong direction. That has been debunked, and endometriosis is not due to retrograde menstruation. But what we do know is that when people are diagnosed with endometriosis, they've usually been tested for everything you can imagine. People with endometriosis can be pain-free, where they have no pain at all, or they have a lot of pain. So they can have pain in their low back, pain in their pelvic region. They can have difficulty with intercourse. And people that are pain-free often don't even know they have endometriosis until maybe they try to conceive a baby and realize that they have infertility. You can have people that have endometriosis and don't suffer from infertility whatsoever. And so there's a whole range and scope and spectrum of what endometriosis can do as far as symptoms. It can cause abdominal bloating, it can cause constipation, and again, it can cause pain. It can cause debilitating menstrual cycles where you just bleed so much during your period and you're bedbound and have extreme cramping. And so those are some of the symptoms. And of course you can have painful intercourse as well. And so how do you manage endometriosis? Well, you can work with top doctors in your area to find out, essentially for them to diagnose that you have endometriosis. And those doctors typically only use exploratory surgeries as a laparoscopy in order to diagnose endometriosis. Typically, they'll rule out other things first before having to do that laparoscopic surgery as a confirmation. But as far as that is how you diagnose it. Now, as far as treatment goes, people will be put on different pills, hormone pills, in order to help manage the symptoms. They can also go through an excision surgery where the physician goes in laparoscopically, hopefully, and tries to remove all the endometrial adhesions that are outside of the uterus. And then that can hopefully improve the symptoms. Unfortunately, that when you go in and remove tissue, you still create scar tissue. So that scar tissue and bounding can still cause pain. So I want to talk about some amazing cutting edge options that we've been doing here at our Edmonds clinic in Edmonds, Washington, that have really helped manage endometriosis. And we're managing this without medication and managing it without surgery. So oftentimes when people, after they have the excision, they'll also, they can go down a soliloquy of ending up getting a resection of the uterus. So they would go through a hysterectomy where they remove the uterus itself as a hopes to decrease the endometrial adhesions and tissues and symptoms causing their discomfort. The issue is that it's endometrial-like tissue. It's not actual endometrial cells. And so, sometimes it is, sometimes it isn't. And so endometrial-like cells also can just be present in other spaces of the body. So removing the uterus doesn't always cure the issue. And it's usually done chalked up as a last resort situation. But I've been meeting with a lot of women in their late 20s and early 30s recently who are opting for hysterectomy. So I'm going to tell you that these are other options as opposed to hysterectomy. And we use these options to help manage the symptoms. And if we can help manage the symptoms and improve the quality of life and or improve fertility, then we don't have to go down these other routes. And so what those are and what we use in clinic is we use visceral manipulation to move the abdominal wall and help decrease the organs movement, so that's called visceral motility. And then we also use manual therapy inside the pelvic floor to help improve the blood flow to all these pelvic organs and to the pelvic floor itself. Now, sometimes people with endometriosis can have endometrial adhesions inside the pelvic floor, so we work on degrading and improving those adhesions in the pelvic floor itself. The other thing that we do is that we will use shockwave therapy on the abdominal wall all around the uterus, really all around the abdomen, where endometrial cells can migrate and leave adhesions, causing discomfort and pain. And oftentimes you won't necessarily feel where those adhesions are. You might just have low back pain, but it's the fact that you have that adhesion in your belly or the adhesion next to your uterus that can be pulling on your SI joint or pulling on your coccyx. And so we work abdominally with the shockwave to help melt and dissolve those adhesions. Now, we don't have any imaging or a pre-laparoscopic surgery and a post-laparoscopic surgery after we use shockwave therapy, but what we do know is that this improves our patient's symptoms so much. We've had so many clients that are able to conceive after getting abdominal shockwave just from freeing up the uterus, freeing up the fallopian tubes and the ovaries, and just improving the normal visceral movement and decreasing whatever scarring and adhesions are laying in that abdominal wall. When we have scarring and adhesions in the abdominal wall, we also can have low back pain and hip pain because of how those adhesions will pull inside of our body, creating some of those discomforts and issues. And so I recommend having shockwave therapy done on your belly. And everyone that has endometriosis should absolutely be engaging in some kind of abdominal shockwave protocol in order to help melt these adhesions and truly free up the organs, because this is making a huge difference for people with endometriosis when they have low back pain, when they have abdominal pain, infertility, constipation, painful intercourse, heavy bleeding. This can really help change the periods and improve your tolerance for the period. And we're doing this with people that are that don't even want to go on the hormones or the birth control, and or if the hormones and the birth control aren't cutting it. They just haven't found a solution that's helped their endometriosis. And so when we're adding in the shockwave therapy along with the pelvic work to opening up the pelvic floor and getting new blood flow into the pelvic floor itself, this is changing the game for endometriosis. And I have a real hope that what we are finding are going to be new long-standing protocols and changes to the way we treat endometriosis, instead of just having to do hysterectomies and do a ton of excisions and laparoscopic surgeries. And so it's really exciting news, and I wanted to share that with you today, because if you are suffering with endometriosis, you should absolutely fly to our clinic here in Edmonds, Washington, and go through a course of intensive manual therapy with shockwave therapy to figure out how to melt your adhesions and improve your endo experience so you're not suffering as greatly, because this can be debilitating. You can also, if you've had tons of failed attempts at IUI or IVF, this can absolutely change the game for improving your fertility. So whatever the mission is and whatever you're truly hoping to get or solution you're hoping to get for your endometriosis, adding in shockwave therapy to your abdominal wall and working on the pelvic floor itself is absolutely amazing and game-changing when it comes to management of endometriosis. I hope you found this video helpful. Please like and subscribe. My name is Dr. Allison Felt, and we love delivering this information to you twice a week, and we hope you find it extremely helpful. If you symptoms of endometriosis, check out some of my pelvic floor opening videos where we talk about diaphragmatic breathing and pelvic floor mobility. And that can also help you start to change your muscle tension and position, helping decrease the pain that you experience from the endometriosis itself. I hope you found this helpful. Look forward to connecting with you in the future. If you have any questions, please drop them below. I love answering the questions. Take care.